Another Indian origin candidate is ready to shake up the US politics. After Zoran Mamdani, the spotlight now turns to New Jersey. An ICU doctor, a Harvard trained public health expert, and now a serious challenger in American politics. Well, we are talking about Tina Shah. In a crowded and high stake political race in the United States, Indian origin physician Tina Shah has entered the Democratic primary of the New Jersey's 7th Congressional District, aiming to unrest the Republican Congressman Tom Kean Jr. What's grabbing the attention isn't just the background, but her speed. In less than 1 year, Tina Shah has raised over $1 million for the campaign, making her the fastest Democrat in the district to cross the mark. As 2026 begins, she has already around $650,000 in hands. So, what's exactly Tina Shah and why does her run matter? Tina was born in the United States to an immigrant parents. She went on to become a triple board certified physician in the international medicine, pulmonary medicine, and the critical care medicine. In simple terms, she works for the front line, treating sick patients after life or death situations. Her education is equally striking. She completed her accelerated 6-year program at Penn State, earned her medical degree at Jefferson Health, trained at the University of Chicago, and later completed a master's degree in public health at Harvard. But here's where the story takes a different turn. Tina Shah didn't stay only in the hospitals, she entered the government at the highest levels, serving as a White House Fellow at the Department of Veterans Affairs and later the Senior Advisory to the US Surgeon General. She also moved into the private sector, becoming the first Chief Clinical Officer at the healthcare AI company and later founded her own enterprises. Now she is bringing all of the experience into US politics. Shah says the current healthcare system is broken, rising costs, worse patient outcomes, and doctors who are exhausted and burnout. According to her, politicians who cut medical aid while offering taxes breaks to billionaires are breaking things worse. And that's where the tension lies. She is openly running against the policies linked to Donald Trump and Congressman Tom Kean Jr., including the proposed Medicaid cuts and restrictions on the abortion rights. Her campaign promises to restore the science and sanity in Washington. For many Indian Americans, this race feels personal. Indian origin candidates are increasingly stepping into the US politics, but few come to such deep medical, political, and fundraising strengths. Still, this won't be easy. You know why? New Jersey's 7th district is competitive and Democratic primary itself is crowded. Experience, money, messaging will all be tested in all months ahead. So, the big question is, can a frontline doctor turn into the real-world healthcare experience into the victory? Basically, I'm talking about the political victory. And does Tina Shah represent the future face of Indian American leadership after Zoran Mamdani in US politics? Tell us what you think in the comments.